Hello friends. So today we are going to talk about a paper which was published in 2024 in Journal of Health, Population and Nutrition. This was a very important paper because it came out with very specific and very new information. So the topic of this paper was the role of hand grip in diagnosing old age problems and morbidity and mortality in old age. So we already know that vital signs right now, what is standard is your blood pressure, respiratory rate, saturation of oxygen. But all these things are very dependent on instruments and it is done by healthcare workers. We came out in this paper with a very unique parameter, that is hand grip strength, and this can be done with little training by anybody. It hardly needs any instrumentation. And what this paper brought out, which was a review paper, that hand grip strength is an excellent tool to find out if patients are dealing with something called as sarcopenia, that is loss of muscle mass. So what happens is, if the hand grip strength, which is recorded by a simple instrument called dynamometer. So dynamometer, there are two types of dynamometer. One is a very big machine or isokinetic dynamometer, which is costly, but then other one is a handheld dynamometer. So it's very easy to do this test. Basically, we ask the patient to hold on to this instrument for 3 to 5 seconds and ask them to squeeze it as hard as possible, and we get a result. We compare it with the already recorded standards in the machine, and we come out with the percentage of hand grip strength. So in this paper, it was pointed out that people who have poor hand grip strength have more muscle loss, and they are more prone to getting morbidities, mortality rate is higher. And it was also seen that Asians, people who have sedentary lifestyle, people who are smokers, drinkers, or have chronic conditions like diabetes, hypertension, liver problems, renal stones, or some sort of cancers, are at high risk of developing sarcopenia, that is loss of muscle mass. So this was a landmark paper because a new vital sign, a simple one, can detect these risk factors and treatment can start early. I hope you liked it.